You might be trusting numbers that aren't telling you the truth, not slightly off, not a little inaccurate, completely wrong in a way that can quietly change the course of your health without you realizing it. Imagine being told your blood pressure is dangerously high when it isn't, or worse, being reassured that everything is fine when your body is actually under strain every single day. It happens more often than people think. In fact, a large portion of home blood pressure readings are significantly inaccurate, and most of those errors come from simple habits that take less than a minute to fix. The kind of habits almost nobody ever teaches you to notice. For years, I've seen this play out in real situations. People come in worried, convinced something is wrong, holding on to numbers that don't match what their body is actually doing. Others walk in calm and reassured, not realizing their readings have been quietly masking something serious. The problem isn't that people don't care about their health, it's that they were never shown how to measure it properly in the first place. Blood pressure looks simple, 2 numbers on a screen. But those numbers are not just data points. They are a reflection of how your heart is working, how your blood vessels are responding, how your nervous system is behaving in that exact moment. They are influenced by your posture, your breathing, your stress levels, your environment, even small things you would never think could matter. And if those conditions are off, the numbers don't reflect your health. They reflect the mistake. When you wrap that cuff around your arm, something very specific is happening. The cuff tightens until it temporarily stops blood flow. Then it slowly releases pressure. As blood begins to move again, the device detects changes in the arterial wall. The first detectable return of flow becomes your systolic number, the top value. As flow stabilizes and becomes smooth again, that's your diastolic, the bottom number. It sounds mechanical, but it's actually very sensitive. It's capturing a moment in time shaped by everything your body is doing right then. That means if your body is even slightly activated, if your heart is beating faster, if your muscles are engaged, if your nervous system is alert, your reading shifts. Not because your baseline health changed, but because the conditions did. One of the most common things people do is sit down and measure immediately. It feels efficient. You walk across the room, sit, wrap the cuff, press the button, done. But your body doesn't reset that quickly. Even a small amount of movement activates your system. Your heart rate increases. Your blood vessels tighten slightly. Hormones like adrenaline are still circulating for a short time. All of that lingers. So when you measure right away, you're not measuring your resting blood pressure. You're measuring your transition from activity to rest. That alone can push your numbers higher than they actually are. The difference isn't small either. It can be enough to shift you into a completely different category on paper. Then there's something even more subtle. Talking. It seems harmless. Maybe someone asks you a question while you're measuring. Maybe you respond casually. Maybe you're thinking through something out loud. But the act of speaking changes your physiology. Your breathing pattern shifts. Your chest muscles engage. Your brain becomes more active. Even mild conversation triggers a small alert response in your body. That alert response shows up in your blood pressure. The same thing happens when your attention is divided. Checking your phone. Watching something intense. Thinking about a stressful situation. Your body doesn't separate mental activity from physical response. It reacts. And the cuff picks that up. Caffeine adds another layer. For some people, especially those who don't consume it regularly, it can temporarily raise blood pressure. It blocks certain receptors in your brain that normally help keep your nervous system calm. Without that braking system, your body runs slightly more activated. Even if you don't feel jittery, your numbers can reflect that shift. A simple cup of coffee before measuring can quietly skew your baseline, especially if it becomes part of your routine. Over time, that creates a pattern of readings that look consistently higher than they really are. There are also physical factors people almost never consider. Something as basic as a full bladder can influence your reading. When your bladder is full, your body interprets it as a signal that needs attention. That signal activates your nervous system. It's not dramatic, but it's enough to create a measurable effect. Your blood pressure rises slightly as a result. Posture plays a surprisingly large role too. Crossing your legs feels natural. Most people do it without thinking. But when you cross your legs, you're compressing blood vessels in your lower body. Your heart has to push a little harder to maintain circulation. That extra effort shows up in the numbers. The same goes for how your back is positioned. If you're sitting without support, your muscles are working to hold you upright. Even though it feels like you're resting, your body is doing subtle work. That work requires energy, and your cardiovascular system responds accordingly. Then there's arm position. This is one of the most overlooked factors. Your arm needs to be at the same level as your heart. If it's hanging down, gravity increases the pressure in your arteries at that point. If it's raised too high, the opposite happens. Even a few inches of difference can change the reading enough to matter. The cuff itself matters more than most people realize. If it doesn't fit your arm properly, the measurement won't be accurate. A cuff that's too tight or too small has to apply more pressure to compress the artery, which can make your blood pressure appear higher than it is. A cuff that's too large may underestimate it. Another subtle issue is consistency between arms. Blood pressure can differ between your left and right arm. For most people, the difference is small. But sometimes it's not. Measuring only one arm without ever checking the other means you might be basing everything on incomplete information. Devi choice also plays a role. Smaller, more convenient options can seem appealing, but they often require more precise positioning to be accurate. The margin for error is smaller, and small mistakes can lead to inconsistent results. And then there's something less physical but just as important: the environment you measure in. Some people experience a noticeable rise in blood pressure in clinical settings. The anticipation, the context, the subtle stress of being evaluated, it all affects the body. Others experience the opposite. Their readings appear normal in calm, controlled settings, but higher in everyday life. That's why measuring at home matters. It reflects your real environment, your normal routine, the conditions your body operates under every day. But even at home, the value of the measurement depends entirely on how it's done. When you take the time to measure properly, something changes. The numbers become meaningful. They stop being random or confusing. They start reflecting patterns, trends, real signals about what your body is doing over time. A consistent routine helps remove variability. Measuring at the same times each day, under the same conditions, allows you to see what's actually stable and what isn't. Taking multiple readings and averaging them reduces the influence of outliers. Ignoring the first day allows your body to settle into the process, and this is where things start to become genuinely powerful. Because once your measurements are accurate, they begin to tell a story. Not just about your blood pressure, but about your overall physiology. You might start to notice that your readings are slightly higher in the morning and settle in the evening, or the opposite. You might see patterns linked to sleep, stress, or even how you feel emotionally on certain days. These aren't random fluctuations. They're signals. Your body is constantly adjusting, constantly responding to internal and external inputs. Blood pressure is one of the fastest ways to see those responses in real time, but only if the noise is removed, only if the measurement itself is clean. Over a period of several days, something interesting happens. The variability begins to narrow. Outliers become less important. The average becomes more meaningful. And that average is what actually reflects your baseline state. Not one reading, not a single moment, but a collection of consistent, properly taken measurements. That's the difference between reacting and understanding, because reacting is what most people end up doing. They see one high number and panic, or one normal number and relax completely. But neither response is grounded in reality if the measurement itself is unreliable. Understanding comes from consistency. It comes from knowing that the number you're looking at wasn't influenced by posture, or movement, or distraction. It comes from knowing that you've removed as many external variables as possible, and when you reach that point, the numbers stop feeling random. they start making sense. You begin to trust what you're seeing, and that trust changes how you respond. It removes unnecessary anxiety. It prevents false reassurance. It creates a clearer connection between your daily habits and your internal state. You can actually see the impact of better sleep, reduced stress, improved diet, or regular movement reflected in your readings over time. That's something most people never experience. Not because it's complicated, but because they were never shown how to measure correctly in the first place. There's also a deeper layer to this that often goes unnoticed. Blood pressure is not isolated. It's connected to multiple systems in your body: your vascular system, your kidneys, your nervous system, your metabolic function. When something shifts in one area, it often shows up in your blood pressure before it becomes obvious anywhere else. That makes it incredibly valuable as an early signal, but only if the signal is accurate. If the measurement is distorted, the signal gets lost. You might think everything is fine when it isn't, or think something is wrong when it's not. Either way, the information becomes unreliable, and when information is unreliable, decisions become uncertain. That's why this matters more than it seems on the surface. It's not just about getting a number. It's about getting a number you can actually use, a number that reflects your body, not your habits in that moment, a number that can guide you instead of confuse you. So the goal isn't perfection. It's awareness. It's understanding that small details matter, that the conditions around the measurement are just as important as the measurement itself. And once you understand that, everything shifts. You slow down slightly. You become more intentional. You create a small space where your body can settle before you measure. You remove distractions. You pay attention to posture. You keep things consistent. None of it is difficult, but all of it is meaningful. And over time, that consistency builds something incredibly valuable. Clarity. Clarity about what your body is doing. Clarity about what your numbers actually mean. Clarity that allows you to move forward without guessing, because at the end of the day, that's what most people are really looking for. Not just numbers, but understanding. Not just data, but something they can trust. And that starts with something as simple as measuring it right.